Welcome everybody. It is August 18th. We're back. Kind of hoped this pandemic would be over since the last time we met 2 weeks ago, but clearly not. And boy, things are changing quickly. So let's just dive in. Gary, what has transpired in terms of COVID frequency and cases?
Well, rather than sort of starting with the worldview, let's just kind of start with what's happening in the Sutter footprint. I'm going to show you this first slide. This is the epidemiology slide from the Sutter footprint. And it's very similar to the last slide we showed, except I want you to go to the Delta surge on the right. The last thing I pointed out in our last video was that the Delta surge is a little bit higher than the very first bump we had, and you can see it on the slide. But now you see that the Delta surge is persisting. It's not going up and up and up like the winter surge, but it's also not dropping really quick. And I think with kids going back to school who are not vaccinated yet because of age, I think the Delta surge is going to persist for a little bit. And hopefully, I doubt it's going to go up. I think it's going to persist and it's going to slowly drop down. So some people at the national level have thought that this may last for 2 to 4 to 6 weeks. It's going to last a few more weeks because we're going to see the effect of children going back to school, having more virus circulating in a couple weeks yet to come. Okay. So that's kind of where the Delta surge is. I can show you the next slide, which kind of shows you our positivity rate at the hospital. And as you can see, just 3 weeks ago, our positivity rate at the hospital was 18% of swabs are coming back positive. That's a big number. And then it dropped. It dropped a little bit, and it's hovering about 12% right now. Some of those are mild, most of those are mildly symptomatic, but a few of those are severely ill, and we're seeing an uptick in hospital cases and an uptick in death rates.
And you know, this is not dissimilar to what we're seeing in the ambulatory side. We've been testing asymptomatic patients, and symptomatic patients. The most recent data I have from Sutter Shared Lab for the month of July is we submitted 300 tests. We had a 10% positivity rate, but the absolute number is small. So in all of our ambulatory facilities, we identified 10 COVID positive people for the month of July.
Right, and a lot of asymptomatic people are getting tested to go back to school, to go back to work, to go to college, to travel. So the testing rates are going up a lot. And also we're seeing more symptomatic patients come to the doctor, to the ER, but I think our testing positivity rate really reflects asymptomatic and mild disease. In fact, I'll show you a couple more slides that I think are really interesting. I get this question a lot. What about breakthrough cases in people who are vaccinated? So this comes from Kaiser Foundation Family, and they take this data from the Johns Hopkins set of data as well as the CDC. The first slide is going to show vaccine breakthrough cases. So I've highlighted in red here California's data because this is collected by state, and it shows that only 1.4% of the breakthrough cases are in vaccinated folks. The next two slides are from the same one, but if you click on the tab for hospitalization rate in California, 0.8% of cases are fully vaccinated, so less than 1%. And the third slide I'll show you is how many deaths have resulted in California from fully vaccinated people, 0.2%. And so really, again, we said this last week, or 2 weeks ago, this is a Delta surge of unvaccinated people. We're not seeing viral breakthrough cases. However, there is a chance that you can get mildly or asymptomatically infected if you're fully vaccinated. So wearing masks, doing the social distancing, and being careful about hand hygiene is still very important. So I think the mask mandate is very important, even if you're vaccinated.
Yeah, I think, and what we're seeing is the vaccine is getting beat up at times because there are so many breakthrough cases that are popping up around. But what you're saying is it's still very, very successful.
That's
minimal
right.
Hospitalizations, minimal deaths in vaccinated individuals.
Yeah, my personal experience in the hospital has been only one patient has been hospitalized that needed oxygen after vaccination, and it was a J&J vaccine. We had one person hospitalized from an mRNA vaccine, but they didn't need oxygenation, and they went home the next day. So the vast majority, and some of them are young. I'm seeing 30-year-olds, 40-year-olds, 50-year-olds, and the case I saw last night, I don't know if they're going to make it. And it's because people are making a decision. Now it's not access. People are really making a choice not to be vaccinated, and there's a tremendous amount of regret now when they're struggling to breathe and trying not to get ventilated.
Okay. Gary, we always try to keep up on the topic of variants. Is there anything new in the variants since we talked 2 weeks ago?
Yeah, the Delta variant is clearly becoming more and more predominant in the US as well as in California. In this county, I would say 98% more of what we're seeing now is the Delta variant and a little bit of Delta Plus. There's a new variant we've been following called the Lambda variant. It came out of Peru, It seems to be just as virulent in South America, but it has not become predominant in the US. And we think it does not have more viral fitness, which means it's not going to outpace the Delta variant. So that's the projections. There's a new variant that hasn't really been, it's been given a B designation, B1612, I think, but it hasn't been given a Greek letter yet. But it happened in Belgium. And in Belgium, there was a nursing home outbreak. And a large percentage of those nursing home patients that were vaccinated with an undisclosed vaccine, probably an adenovirus platform, maybe the AstraZeneca vaccine, a number of them didn't survive. And so the UK and Europe is looking very closely at this new strain out of Belgium, but we haven't seen it in the US in any significant amount, like very, very small numbers. But that's going to have some attention in the world. And I think every 2 weeks we may see a new variant pop up, but we don't know if it's going to be a predominant variant.
Right. Okay. I'm going to switch gears to vaccinations. So 2 months ago, when things were calming down, the vaccination clinics were closing down, we kind of thought we'd put this behind us, but now it's big topics. And for you, the providers on the front lines, I'm sure you're getting a lot of calls about all the noise out there about vaccinations. There's a lot of chefs in the kitchen between the state and the federal government. Biden today, says, hey, we should have a booster dose for everybody after 8 months. There's a lot of chatter out there. One of the things we want to point out, because some people wonder why Sutter might be slow to respond to some of this, part of the contractual arrangement for all parties that are delivering this vaccine in the United States of America, so it's us, pharmacies, everybody, is that we have to abide by CDC guidelines. So Sutter Health and everybody, including the pharmacies, will not change their policies until the CDC actually formally approves of a change. So that's why you might hear a lot of noise, a lot of different parties, but we don't do anything until that is triggered. So that seems to have happened now with the vaccine dose for the immunocompromised felt to be about 3%. So can you give me some background on what's the biology behind the need for that?
Yeah, I think it's important if we go back to science, because I think you're right, Gary. It's very confusing. The White House makes a statement, the FDA says it's okay to do it, but the CDC is still looking at the data and they haven't changed their vaccine policies yet. And so people are getting conflicting information, and it's correct information. The White House really did say that. Yeah. The FDA really did say that, but the CDC has not changed its recommendations yet. So this is data that comes from a CDC presentation I heard just a couple weeks ago. And this looks at neutralizing antibody titers. So when you get a vaccine, you make an antibody response. And these antibody proteins will be part of what gives us the protection. Now there's two lines of protection. There's the antibody protection, and we can measure that. And then there's this lymphocyte protection. We can't really measure that well. So according to the CDC data, neutralizing antibody levels, they were really lower in 4 specific categories: cancer patients, in patients who are on dialysis, in patients who had organ transplantation, and that's the yellow ones. And the last one there is people on immunosuppressive therapies, like biologic therapies for rheumatoid arthritis, Crohn's disease, and other inflammatory diseases. And as you can see, the organ transplant patients fared the worst. Yeah. Their neutralizing antibody titers were not high. So based on in vitro data, based on serologic data for neutralizing antibodies, we're concerned that these 4 categories could be the most vulnerable. Interesting here, you don't just see the frail elderly, because we've seen some deaths in Sonoma County as well as in other places where the frail elderly don't have that same immune bump. And I think those are going to be the 5 fragile categories. Okay. People with cancer, especially on chemotherapy, dialysis patients, organ transplant patients, immunosuppressive therapy, especially things that are very B-cell depleting, like Rituxan, and then the frail elderly. So this in vitro data is why the CDC says, hey, we should think about boosters in the immunosuppressed. Okay. But what we're not seeing in the hospitals, we're not seeing immunosuppressed patients. So when I take care of patients in the hospital, they're unvaccinated, but what I'm not seeing is vaccinated oncology patients, vaccinated patients on Rituxan. Okay. I'm not seeing vaccinated advanced HIV patients. So I'm not seeing breakthrough cases in the immunosuppressed patients, but it is a concern based on neutralizing antibody. Okay. And maybe over time, the antibody titers will drop even more, and then they become more vulnerable. So that's why there's this discussion and this thoughtful decision making on the immunosuppressed patients.
So this is a decision the CDC has made based on laboratory data, perhaps being proactive before it becomes clinical data.
Absolutely, that's a very good way to state it.
Okay. Now for your information, what you need to know, let me show you my next slide, which talks about the CDC definition of whom would qualify for this additional vaccine. Now there's a lot to read there. I'm not going to read it to you. I'm going to give you a moment to look at that. And so the nice thing I think about this slide is the last category, which you don't see in other CDC writings, is the actual drug groups that might be useful. So my next slide is information that's been prepared to communicate with our patients. And this is a smart phrase that you can all start using in response. The key point here is that you do not need to be involved in patients desiring to get this shot. There's no order required by you. They don't need any paperwork from you. They can self-attest to get this. So they can walk into a pharmacy, once that pharmacy is providing this vaccine, and just say, I attest that I have a need for this, and they can get it. So you should not need to be involved. So hopefully it won't be much work for you. And then my last slide, when you send them that smart phrase, it gives them a link to vaccine resources, which is the standard Sutter Health slide. And this is what they see when they go there. And it gives them the opportunity to call Sutter to schedule an appointment. For your information, the only place we're administering this vaccine here in Sonoma County is our walk-in clinic. So there are options if they want to do it through Sutter or the walk-in clinic. They can always go to a pharmacy. This slide also on the Sutter site references the myturn.gov, I think it is, which outlines all the vaccine sites in California. So patients will have access to that. So I'm going to move to another talked about future use of vaccines, and this is that general booster dose that's getting a lot of play right now. It just feels like there's a lot of chefs in the kitchen, but what do you think about that?
Yes, the Biden administration came out and said we really want to get a booster shot for everyone. And I think that the data doesn't support that yet. With the Delta variant, I think that it's not as necessary right now because we're not seeing the clinical cases. Now, when the studies were done for Pfizer and Moderna, those studies follow people for 2 years. So we're still tracking how those people are doing with their neutralizing antibodies, and that information is forthcoming. But at a time when the rest of the world is not vaccinated yet, I'm not sure from a social justice perspective if I would really promote giving vaccine to everyone because people are anxious, but they're not really coming in with disease. Now, if our immunity wanes and we see clinical breakthroughs, that's important. If we get a new variant that hammers the vaccine, that's important. But my personal take is, as an ID doc, putting on a public health hat, is if the rest of the world is not vaccinated, we're going to see more variants spring up. Also, we have some vulnerable people here. Maybe the elderly do a better job with vaccinating them. What about kids? Children pediatric vaccine should come out, hopefully by October from Pfizer, if it's approved. That's a whole cohort of patients that if we don't vaccinate, then we're going to see more variants spring up.
And that the argument about the ethical issues around the world, I agree with you. You're seeing letters as the editor to that effect, but I think we probably fully expect the CDC to agree with this, and this will be coming to our local theaters, as we say. So what we're actually doing is preparing to resurrect our vaccine clinic, perhaps to accomplish this general booster dose in case the CDC does that. Now, I just want you to know, and when I say we're going to resurrect the vaccine clinic, it's weeks away, folks. It's a big job to get the clinic up and running. We have space, but there are staffing issues, and particular staff. You need to have licensed staff to drop the vaccine. There's a whole EPIC build. This is, as you explained to me, this is a new order. So they cannot just give this vaccine from their usual stock and tell the feds they give it. They have to create a whole new order set. There has to be a new code that goes back to the feds. It's complicated to deliver these vaccines. And then there's the whole storage issue too.
Yeah, there's a storage issue. There's we thaw the vaccine, you have 5 hours to give it. If you don't give it in 5 hours, you have to discard it. How much gets wasted? We have to calculate, and report how much is wasting to the state. And I also think on a worldwide stage, I think the Biden administration is probably going to square off with the World Health Organization, who has said before, please don't give vaccines unless you're, giving it to unvaccinated folks. So I think there's a lot politically and operationally that has to happen in order before we start doing that.
Okay, we'll keep you up to date on that. You'll get plenty of warning. Last thing I wanted to cover is something that I assume you are aware of, have read about it, and these are the several mandates that have come down regarding our workforce. The first was from the California Department of Public Health, which is probably a week ago, has mandated that all those, for our purposes, all those people who work in healthcare, if you're unvaccinated, you're required to be tested on a regular basis. And then subsequent to that, Sutter Health came down with their requirement about vaccination. And that is a requirement that the expectation that all individuals who work at Sutter sites be vaccinated. I will tell you that our board, SMUGR board, has discussed this, and along with all the medical groups that are affiliated with Sutter Health, and we wholeheartedly endorse these policies and applaud the effort to create a very, very safe work site for us, our peers, and our patients. What the specifics of it are, we do anticipate that all of our providers will be vaccinated. The Sutter Health policy requires specifically that you either be vaccinated or have an approved exemption, and there's a pathway for getting a religious or medical exemption. And then you couple that with the state, and it's the state that's requiring the testing. So you couple that with the state says all unvaccinated individuals for any reason are required to be tested, and testing for those who work in the ambulatory setting is once weekly. For anybody who works in the acute setting, the hospital, have to be tested twice a week. Since the testing mandate is a Department of Public Health mandate, then Sutter or SMUGR is not going to be providing the testing nor paying for the testing. So those individuals would have to use the public resources, so the community resources. Again, we anticipate, I hope I'm preaching to the choir. And in fact, if you have been vaccinated, then you will not hear any more about this. Most of us, if you did get vaccinated through Sutter Health, then your proof is in the Employee Health Services data bank. Sutter has pulled that data and perused that. If for some reason they don't have your data or you got vaccinated elsewhere, then at 4:07 yesterday, you should have received an email from Bill Eisenberg, Chief Quality Officer, saying, we do not have evidence of you being vaccinated, and it gives you the opportunity to provide that vaccine proof to them. And if you did receive one of those emails yesterday, I would suggest you get on that right away so that you don't fall into this cohort of individuals whom starting Monday, August 23rd, we're going to start requiring testing on a weekly basis. So hopefully I'm preaching to the choir, and this is the last you ever hear of it. My last slide, however, for those of you who are interested in the policy and the wherewithal, this is a slide that is for clinicians only. And you will see there's links there to have everything you want to know about the vaccine policy from Sutter Health. You will have the link to this site from the information you received again yesterday from Dr. Eisenberg, our Chief Quality Officer. About midday, he sent an email to all of us announcing the vaccine requirement for Sutter Health. So that's all we have today. There's a lot going on, and it's a very difficult time, I know, to practice medicine. But I know, Gary, when I round on our clinics, I'm really inspired by how everybody's just kind of taking it in stride and doing what they need to do to provide good patient care and to keep their peers and their patients safe. And I just tell you, hang in there and keep it up. It's difficult right now.
Yeah, I think it's a marathon, not a sprint.
Yeah.
And I think we just need to hold one another up, and I think that's very important.
Yeah. All right. Thank you for now. Bye-bye.